Hello everyone. Thank you for joining me for this module that will cover the anatomy of the hand. The intention of this module is to improve your approach, or at least inform your approach, to dissecting this region of your donor in BMS 575 this semester. So I'd like to start by inviting you all to get into a good position so that you can see what I'm seeing here, the donor, as well as me, and that I'm not obstructing your view at all. Feel free to move about the space throughout this module as you'd like. If you'd like to inspect something more closely, feel free to do so. You won't get in my way or anyone else's way for that matter. So if we start here with the donor in what we would consider a supine position, looking at the anterior aspect of the palm of the hand, we can see and imagine if we were dissecting through the skin from a superficial to deep direction, or in a superficial deep direction, the first structure we would hit would be this collection of veins, the palmar digital veins. And that would expose to us the distal attachment of palmaris longus, the palmaris or the palmar aponeurosis. Now we can see our first kind of layer of muscles, as well as some deeper structures that we'll get to in just a moment. So let's take a look first at the thenar eminence, or the portion of the hand that has muscles that control the thumb or affect the thumb. So we can see here, kind of most superficially in this thenar group, would be the abductor pollicis brevis muscle, exposing two muscles just deep to that, the opponens pollicis muscle, as well as the flexor pollicis brevis muscle. If we look at the analogous muscles on the hypothenar side, or on the pinky side, or on the ulnar side, we can see the palmaris brevis muscle. This muscle is similar to the muscles of the face in that it is often intricately integrated into the superficial fascia and the skin, so it can be a bit tricky to find and to not tear as you dissect through it. So now looking at that hypothenar side, we can see a similar presentation of muscles that we observed with the thumb, the abductor digiti minimi muscle of the hand, flexor digiti minimi brevis, and then deep again, opponens digiti minimi muscle of the hand. So before we get into the lumbricals, that deeper layer there, we're going to look at these venous structures here. So we can see a venous structure here, the continuation of the median antebrachial vein passing just deep to that, in this case, flexor retinaculum. We can also see this superficial palmar branch of the radial artery. And then we can see a couple of arches here. We can see the superficial palmar arterial arch, as well as the superficial venous palmar arch. And now we can see the lumbricals here, as well as here. And I want to draw your attention to their orientation. We can see them attaching to flexor digitorum profundus on the anterior aspect of the palm. And if we trace their attachment to its distal point, we can see that it's actually attaching, if I just spin ever so slightly, a bit anteriorly. So as we're dissecting from a proximal or interproximal to distal direction, and we see our lumbricals, we want to follow them as far as we can, as distally as we can, to where we see them attach on that posterior aspect of the hand. So if we remove the lumbricals now, pulling them from their attachment on flexor digitorum profundus, and if we remove flexor digitorum profundus, as well as its friend, flexor digitorum superficialis, we can now see a deeper layer of muscles. This is including the interossei, as well as the adductor pollicis muscle, both the transverse and oblique head. Now, if we spin the donor around and look at a posterior aspect, we can see a similar presentation again. We've got a venous collection, we've got arteries, and then we can see our interossei muscle that we were just looking at from the anterior side. Removing extensor digitorum, we can see again a little bit more clearly just how deep those interossei muscles are. That concludes this module covering the anatomy of the hand, as well as some of the structural relationships. We hope that this has been helpful for you, and please feel free to come back and view this module as much as you'd like.